is a form of treatment that uses radiation. Radiation, as you know, means the transmission of energy through the air. This energy is transmitted sometimes as particles and sometimes as waves. Ultimately, radiotherapy means using high energy, usually X-rays and sometimes gamma rays, for the purpose of treating the patient. Radiation is a treatment modality designed and delivered according to the patient's body. The patient's body anatomy is truly important for the radiation you deliver. We calculate and deliver your radiation according to that anatomy. All machines are capable of doing it this way, but the only way to understand that the patient has that anatomy is to utilize imaging. We use imaging both as a tool for pre-treatment planning and to perceive the treatment position of the day when our patient applies for treatment and lies on the machine. So, what we call image-guided radiotherapy is actually the only type of radiotherapy that should be applied today, and we perform radiotherapy by seeing. This is generally called image-guided radiotherapy or image-assisted radiotherapy. Stereotactic radiotherapy is actually one of the most important developments of recent years. Here we achieve this by using highly concentrated beams. It's used to ablate or destroy small foci detected with special systems like PT or 3 Tesla MRI without touching the patient. For this reason, it's sometimes referred to as stereotactic radiosurgery. So the goal in radiosurgery or stereotactic radiotherapy is to eliminate certain tumor foci and structures deep within the patient without touching them. That's why we call it stereotactic radiotherapy or radiosurgery. Specifically, patients with a limited number of metastases are often not suitable for surgery after these metastases are controlled with systemic treatment. For example, a patient has 7 metastases. Instead of removing metastases in 7 different areas, we perform irradiation with high doses aimed at them using stereotactic radiotherapy, which delivers high local doses to permanently kill cancer cells. And through this irradiation, we pave the way for a cancer treatment that is better integrated and strengthened with the patient's ever-increasing systemic therapies. These stereotactic radiotherapies are frequently used in our clinical practice because they can be given during chemotherapy and have the potential to increase the effectiveness of widely used treatments like immunotherapy. Generally, for foci in the brain, radiosurgery or stereotactic treatments for the brain, for the lungs when it's in the lungs, for the liver when it's in the liver, for the adrenal gland when it's there. Sometimes we use them as accelerated treatments for the prostate. So prostate treatment that used to take weeks has actually been reduced to 2 weeks and 5 days for low risk and intermediate risk prostate cancers. And with this 5-day treatment, in new studies, we can now achieve results equivalent to surgery with fewer side effects using this stereotactic treatment.